There we go. All right, I'd like to thank
Can you make
everyone.
me interpreter, please, Martha?
Oh,
I'm
yes,
not
I'm
an
sorry.
interpreter yet. Thank you.
I'm sorry, hold on.
Thank you.
Give me 1 second, everyone. Talk amongst yourselves for 1 second.
Couple of people, participants from Puerto Rico, I'm seeing on the chat. So thank you for, gracias por saludar y acompañarnos hoy.
Gabriela, ¿ya? ¿Está? Okay. All right. Thank you, everyone. Welcome, and thank you for being with us for today's webinar, Using Industrial Hygiene Practices to Prevent and Control COVID-19 and Other Infectious Diseases. Go ahead and go to the next slide. We are using interpretation for this presentation, so if you want to listen to this presentation in Spanish, just go to the globe icon at the bottom of your Zoom screen, click on it, and it'll give you the option of listening in Spanish or English. And we also have this presentation in Spanish and English to view. So if you want to look at the Spanish slides, simply go up to the top of your screen where it says View Options and choose, I believe it's labeled Versión Español in Spanish. And then my version, Martha, is in English. And just to remind you that this presentation is accredited for continuing medical and nursing education. You're going to receive a copy of all these slides that include all these instructions for submitting your evaluation for accreditation. And just to cover all our bases, we have no relevant financial relationships that relate to this presentation, nor do we have any relevant financial relationships with ineligible companies whose products or services are related to pertinent therapeutic areas. Let's move on to the next slide. And to cover the agenda, I'm just going to go ahead and hand it over to Dr. Maricel Pagan Santana. Thank you for being with us, and I'm just going to go ahead and let you have it. Go for it.
Thank you, Martha. So my name is Maricel Pagan Santana. I'm the Director of Environmental and Occupational Health at the Migrant Clinicians Network, and currently I'm based in San Juan, Puerto Rico. Today, we're going to go over some of the questions, controls, and strategies regarding infectious control. And I want to make sure that even though we're focusing on COVID-19, we're able to say that this is going to be applied to other infectious diseases like flu and mycoplasma that are also in the air or surfaces, and we can then address how to control and address some of the issues that we are seeing regarding this infectious control, especially when we're talking about outpatient settings and or human resources, how to protect our workers. In the agenda, we're going to go over some of the ventilation strategies and resources that we have for you. And we're going to have some other strategies that we've been seeing since the pandemic started. We're also going to go over some of the respiratory protection and what that means and what it means to have a respiratory protection programs. And at the end, we want to go over how much does it cost, like infectious control, how much we may see the implementation of ventilation and other programs as something that is expensive. But at the end, you'll see that the benefits are higher than the cost that it takes not having everybody protected and having some of the implementations of these controls. Next slide. We're going to go over, and our objectives are discussing control and strategies available, presenting the best practice that we have seen through the pandemic and before that, and going through economic advantage and disadvantage of implementing these controls. Next slide. So when we're talking about air quality and ventilation, please go to the next slide. We have to consider a couple of things where we're seeing, we're talking about infections control. We need to know how many people we have in the space that we are talking, how close are our indoor space in terms of, do we have windows? doors that are going to be open constantly or permanently? Do we have a way to be this that at a distance from the patient or other employees? If we're talking about something like a call center, for example, that may not have people arriving, but you may have a couple of employees near each other. The duration of the exposure, are we talking about 15 minutes? Are we talking about 30 minutes, 8 hours, etc.? Ventilation, do we have anything extra going on? There's fans. Are there any other systems that are helping out some of the air control that we have indoors? Do we have anything else going on? Are there mask presence? Do we have disinfection and hygiene going on constantly in our places? And the type of activity that we're doing. Are we doing an outreach activity where we're doing training and doing some of the health-related education that requires talking or even movement, or are we just staying still, waiting for people to come in? So having people talking or singing or moving is going to make a difference on the type of exposure that we have. Next slide. So so we can get an idea of how the type of activity and places with poor ventilation, meaning that we don't have an exchange of air going through the systems. This is a representation of the difference between being silent, talking, or shouting and singing, and the timing that happens, like 2 minutes, 15 minutes, and 1 hour. In how a place that has no ventilation or a poor ventilation system, how the particulars of the people who's talking, like that we breathe, can basically fill up our spaces in room and can become then an infectious doses or a higher risk place for infections. Next slide. And just an idea, if you see how fast we get that room fill up with with a poor ventilation, you can see that the aerosols or what we breathe remain in the air and can increase in concentration. And that is going to be highly important when we are thinking about dose and exposure. It's not the same being 5 minutes in an elevator that may have, or 5 minutes is too long, I think, for an elevator. Let's say like 30 seconds, 1 minute in an elevator, which is probably one of the worst ventilation spaces that you can be. You can see maybe you're 1 minute there, your exposure to the concentration is really low, versus in a poor ventilated space for more than 30 minutes, 1 hour, etc. So you're gonna see that the exposure in dose of concentration of those infectious particles are gonna be higher the longer you're staying up in a place with a poor ventilation system. Next slide. So how do we manage this? How do we address this in a way that, one, is going to be effective, and two, is not going to create a dent in financially in terms of my organization, but also it's going to be effective. It's going to be something that we can sustain and apply in its places. Usually we're going to see engineering controls or changing the structure, administration or administrative controls, which is mean changing the way that we work, or using protective equipment, which is usually the least effective. I'm sorry about that misplacing of the least and most. Those the protective equipment is going to be the least effective of all the controls. So when we are thinking about that, just think that when you're using something like an N95 or a respirator of another type, or even a mask, a medical mask, you're depending on the person who uses it for the effectiveness added to whatever the equipment can provide for you. When you're doing an engineering control, you implement a system that is designed to prevent that contamination or infectious disease to spread. So you don't depend highly on people who might be tired, who might be distracted, or who might be doing multitasking or doing more things that one and might forget to put on their mask rather than just having a system that is working without any intervention. Next slide. There are different measures for us to improve ventilation. The first one being natural ventilation. If you have space and you have the weather and climate to actually open windows, that's the first thing that we usually will want to do. A lot of the places that have, let's say, a good temperature outside will be made with natural ventilation and cross ventilation, which means that they're designed to get the air moving to one place and another. We usually avoid using that, and I can think about at least where I'm from, Puerto Rico and maybe Florida, as places that may be designed to use cross ventilation, but we usually alter that design or change some of the structure to add a air conditioner or other systems that then affect that cross ventilation. So when you see those windows and you are able to open them, that will be your first step to improve the air. The more I open windows, the more clean air is gonna enter to some of the spaces. The concentration that we saw in those closed rooms is gonna be diluted, and then I'm gonna have a lower risk of exposure. That being said, we have some limitations with natural ventilation. You may be in a place with a lot of traffic by the side, and open the windows might be related to then having other pollutants entering to your indoor, and that might not possible for you. If you're in a school or you're in another place, that may be noise that you're trying to avoid. So there are some considerations to natural ventilation that we have to take when we're doing this. Filtration is another option that we have. Usually we have the option to, when you have a general system or a structure that has a HVAC or a heat and ventilation air conditioners in systems, you're able to improve or install filters to then have an efficiency and removing those virus particles. The minimum efficiency value filters are called MERV, and there's a recommendation to use a rank of 13 or higher to capture 70% of small particles. And take in consideration that 70% is actually a lot. Maybe people who may want like 100%, but 70% in combination with other controls and strategies may offer you a good option in terms of how costly might be other systems. Next slide. There's also purifiers. Those are highly, highly wanted during these times with the COVID pandemic, but also they can be put basically anywhere that you are able to connect or have electricity. So these purifiers will usually have a high efficiency filter, or what we call HEPA, and they will capture 90%, 99% of the small vital particles. That being said, not every air purifier is made the same way. So it's important to look at your space, the type of, the size of the space that you're trying to clean up, and then look at the manual or manufacturer indications about what is that purifier providing for you. You may have a purifier that's too small for a big space. It's not gonna be cleaning up the way that you think it's gonna clean it up, but also you may be spending more money in a system that is bigger than your actual needs. Other adjustments that can be easier, similar to opening the windows, you can just improve or increase the intake of outside air from an air conditioner, but with the connotation that will mean in some cases that the air or the space gonna get colder. So it might be a comfort issue for people who are there. Next slide. So we are gonna go over some of the things that we have to think when we're selecting a purifier, and we're going to go over because this is one of the most asked questions that we get, and also one of the easiest way or accessible way to get some ventilation and units in your smaller places like offices or small reception areas. Again, make sure that your purifier is adequate for the size of the room. Usually that's on the description for the manufacturer. You can look at the specified amount of air that is gonna be delivered for per minute, and that's gonna be labeled as CADR. Usually the manufacturer is gonna indicate how many particles the unit is gonna remove in terms of size. And we're always saying, like, we avoid selecting units that contains additional fixtures. It's not that they don't work. It's usually that they don't add any additional benefits, but they do add additional cost. And also some of the items like bipolar ionization are still kind of like on the fence of some of the agencies in terms of recommending them to be used in places where people are have access to the purifier, or places that may be pose some risk for workers or children that may be accessing that unit. So some of the UV and bipolar ionization can cause some exposure issues on the might be on the eyes or maybe on the skin because of the exposure to ozone that you can get. So we want to avoid selecting those units. However, there's some systems that can create that are not independent units, like more on the system that gets into the central air conditioner system of the structure. That might be an option for UV and bipolar ionization if it's the case. But for now, our recommendation is to avoid selecting units that contain additional features because of the risk and also the cost not being something that actually increase your protection. And then do not use units that intentionally generate ozone to do some decontamination or disinfection. That's not something that we want to do. That might be adding some risks for people who are there or for workers. Next slide. Their purifiers are available in a variety of shapes and sizes. They're also range for prices. Again, you should be just looking at the manufacturer indications. Make sure that not all purifiers are HEPA purifiers. So just make sure that when you're gonna select, you see that HEPA filter notification, you see that there's appropriate for the size of your room, and then look at the price range to see how comfortable you are implementing those in your workspace. Next slide. Just an idea of how much we can reduce risk when we're addressing ventilation using a purifier or having a system that do 4.5 or more change per hours can have a risk reduction of 90%, which is basically the same risk reduction that having everybody use N95 respirators. So think about that when you think about how uncomfortable can be using an N95 in your daily work, and how easier will be just to have a system that's doing that for you and can then prevent those risks that you have. That being said, that doesn't mean that we're not supposed to be masking. You can be using medical covering, medical face mask, or you can use respirator if you feel or you have information that that you are a higher risk in your area. But just to know how effective it can be or how protected it can be, just increasing your air changes and having that filtration going on. Next slide. So some of the during this pandemic, there are also some other additions to how we can control the air quality and look at ventilation to control infectious disease. Next slide. One of them is using fans and opening windows. Just make sure that the fans are not being pointed at people, that if you have one fan, that should be close to an open window and pointing out. What we want to do is get that fan to suck all the air from the space to get all that concentration on infected particles or viral particles out of the space. And then using ceiling fans to help improve air circulation. And whether when it's possible, that fan should be in winter mode. And I'm gonna explain the next slide why. But just make sure that we have open windows. We have fan looking out of the window so we can get out. If you have a secondary fan, more than one, you can get one fan that is pointing into, so it's bringing new air quickly to your room, so you can create kind of like a circulation, getting some air out and some clean air in. But if you only have one fan that you can put on the window or just one window, just make sure that that one fan is just pointing out and getting as much as contaminated air that we can. Next slide. So in terms of the fans that we have on the roof or upstairs, the reason we want to make it in winter mode or clockwise mode is that is going to create circulation that is going to suck the air from down to upwards, and then it's going to create a circulation of clean air or a circulation of air that is going to go through the walls. So it's not going to go directly into the people. It's not going to go, it's not going to circulate air that is contaminated directly into where people are sitting, but mostly try to connect that air into the walls where your window might be facing, and you can create that circulation of air, contaminated air out of the space. Next slide. There are also do-it-yourself or DIY independent units like HEPA purifier, but make it your own. They're cheaper, they're more accessible in some cases. So one of the studies that was conducted in terms of the efficiency of these types of independent unit or at-home units revealed that at least 73% of the air aerosol exposure was reduced. So they're highly efficient, and they're less costly than getting a new air purifier. For example, in this case, they're using a MERV filter that is range 13, like we talked before, and they're using a ventilator and creating kind of like a box. The efficiency of this system is going to depend on the type of filtration or filter that you put in on the box, and it's going to depend on the velocity of rotation that you have in that ventilator or fan. So if you have one that has high velocity, that kind of like the air is going to flow faster, so the intake of air is going to go faster. You're going to take more air per hour. If you have one slow fan, that may not be that 73% efficiency, but it also will help. Next slide. We also saw a lot of the use of CO2 monitors. They can be used as an indicator. I want to address that they're not equivalent to know if you have a lot of COVID particles in your space, or that means that you're going to get exposed or infected, but they're a good indicator of how well ventilator can be the space that you are. They usually work best in places that tend to be crowded and less crowded from time to time, maybe a reception or a waiting area. And it depends on the activities that we're going to do. If you're going to have quiet individuals all the time, or it's going to be a quiet space with people who enter maybe 1-2 times a day, might not be the best indicator of if that place is going to be contaminated. But if you have a place that's going to be crowded, there's going to be a lot of activity, talking, maybe singing or moving a lot in the space, these are good indicators of knowing if the place is well ventilated or not. Next slide. Next slide. So in terms of the administrative controls or things that we can change, we usually use a lot of the disinfection and sanitizing, cleaning just make sure that you know the difference between cleaning, disinfecting, and sanitizing. We want to do cleaning for areas where we're usually not aware, or we're not sure that we have people who are infectious or contaminated. It might be just routine cleaning. Usually we're going to use soap and water, and it's just going to be decreasing the number of germs that you're going to have in some of the surfaces. Disinfecting, that means that we're going to use chemicals to kill germs on the surfaces, and that may be necessary in high contact areas. It's going to be necessary in places that you got patients that might be suspected or confirmed COVID cases or infectious disease cases. Sanitizing is usually going to be led to areas that have some type of safe level or parameters that are regulated. So we're not going to be sanitizing unless we're talking about surgery room or areas like laboratories that need to be a safe level or numbers of germs. So you're going to focus on cleaning and possible disinfecting if you're using chemicals to do that. Next slide. If you're doing disinfection, just make sure that you use EPA registered disinfectants. There are ways to know if you're the one that you're using, or if you're looking to get a new one. Just use the site, the webpage. It's going to show you the type of space that you like, the places that you can use it. By use site, you can see the active ingredients, and you can see how much time you have to leave that chemical on the surface to actually be effective. Next slide. So just an idea of how the EPA list works, how you're gonna get it. You can see the whole table, or you can go directly into searching a specific disinfectant that you wanna see. But basically, you're going to see the EPA registration number, and you're going to see the contact time. Make sure that you use that contact time to actually guide the process of disinfection. If we are going to use registered EPA disinfections, and I apologize, I see that this slide wasn't translated, and we're going to get that to you when we get you the slide. It's going to be translated. But just take in consideration that we are having a list N of EPA. And basically what EPA does is make sure that the persons who propose this disinfectant as something that works with COVID and other infectious diseases actually report some of their results in labs or research that either present efficacy against the virus, their efficacy against something similar or stronger than the virus, or are efficient against other coronavirus or COVID-19's overall variants. Sorry. So you're always going to be looking at what you have, even though there's going to be a lot of sellers or the usual that you have been using for some other stuff. Just make sure that they're part of the list N if you're doing disinfection, and make sure that you are using the contact time that is recommended to be able. Also, there's a formulation type. There's also a way to use them. Some of them are used concentrated. Some of them are used diluted in water. Next slide. When we are doing this, make sure that you're reading the labels of what you're using for disinfection. If you're not the one using it, but you are the one recommending, just make sure that the people who are in charge of doing that process have information about the risk in the areas that they have to have, like if they have to use gloves, if they have to have more ventilation while they're using the disinfection. Make sure that our systems in terms of hours and operations do not interfere with the cleaning and disinfection. What I mean is, it's not recommended that you are doing disinfection while you are also accepting patients or having some public in. So if you're using a disinfectant, that may be creating some reactions of people, especially people who are more vulnerable, like children or people who have chronic disease or chronic respiratory disease. So it's important to not have that area occupied by people while it's being disinfected. So it's like we have to take that in consideration when we're doing these processes and make sure that the person who is in charge of doing that disinfection know the risk of using that disinfectant without the appropriate protection and the appropriate processes. Next slide. Just as a wrap up, for elimination of disease, make sure that you do clean with soap and water first. Ensure there's adequate ventilation. We don't want anybody having some issues in terms of exposure or of inhalation for those toxic vapors related to the disinfectant. And just make sure that you determine the frequency of that cleaning and disinfection according to the levels that we need to do if we're gonna address some regulatory levels, or if we are gonna just do some routine cleaning. Next slide. In terms of respiratory protection programs, we know that some of the areas that we have require respiratory protection program, and it's recommended to some of the areas depending of how the community transmission is going on in terms of the infectious disease that we are addressing, but also the type of relationship and interaction that we have with people outside and inside of our workspace. Next slide. There are a couple of types of protection available for respiratory protection. We have seen from cloth masks to disposable masks, and then we have two types of respiratory protection available that are actually regulated. That will be medical masks and respirators. Both of them have really high efficiency, so they're recommended to use. Medical masks are more available at this point than they were a few years ago. And respirators, just make sure that you know that respirators are regulated, and that we need to make sure that we provide, if we're gonna require respirators, you're gonna provide them to your employees, and you're gonna make sure that they do the requirement from OSHA in terms of fit testing and other requirements that given that N95 means. But also know that N95 is gonna an equivalence to, it's not just that N95 disposable N95, but also the equivalence to an N95, which might be N99 and N100. They can be used and they are highly effective to avoid some of the risk of infection. Next slide. Just make sure, again, that when we're trying to choose a respiratory protection and we want to do that investment and basically require that in our workspace, make sure that you look at the type of exposure that we're going to have, the population that we're addressing, vaccinator, if we're going to be near and having contact person to person in that area. If our space is not well ventilated, we don't have any improvement in ventilation or any systems helping and aiding or disinfection control or infection control, the distance, the capacity of the site, and exposure of duration. Also take in consideration temperature and humidity, because some of the respiratory protection might be somehow affected by that, and some of the areas might be too humid or too hot to actually last longer in terms of the mask or respirator that you're going to be using. And then the equipment features, this is something that is going to be adjustable, so something that is going to be durable, and again, regulatory implications, what it means for me to request of everybody using that as part of the workspace, or voluntary using that as part of the workers protection programs that I have, but also what it means in terms of cost and how we are gonna implement that on our systems. Next slide. So if we're gonna go ahead and purchase, that might be by your own, or might be because it's required for your operation. Just make sure the respirators, if you're gonna implement a respiratory protection program that is going to include fit testing. You should have respirators that are NIOSH approved. NIOSH is the National Institute of Occupational Safety and Health. They're going to be the ones that are going to be certifying those respirators. And OSHA at the time is going to be requiring you to use those types of respirators if you're going to be implementing a respiratory infections and protection program. Medical masks are also regulated. They're for quality. So if you want to make sure that you're using a medical mask that is also with good quality and is actually representing the numbers of efficiency that we just discussed, just make sure that you have the bulks will have the levels from the American Society for Testing and Materials. Those are regulated from through the FDA rather than NIOSH. And that number, thank you, Martha. That number is gonna let you know the level of that medical mask and how well it's gonna protect. So they're gonna vary. There are several levels, but just make sure that even though they look the same, medical masks and disposable masks are not the same, and medical masks are gonna be regulated. Next slide. When we're using masks, that may be masks or respirators, just make sure that you wash hands, review conditions. We know a lot of people are reusing their disposable masks or N95 respirators, or might be KN95 respirators. Just make sure that the condition is well, that still fits you well. If you notice that it's getting loose, it's time to get a new one. If it's dirty, broken, or just not working well for you, it's just too loose in your face, you should be able to get a better fit, another type of, might be another manufacturer, might be another size. During the use of your mask, just make sure that your mouth and nose are covered and avoid touching. Also, when we're using face masks and respirators, we should not be having any makeup on, or we should avoid having any facial hair that can just break that seal that you're trying to create with your face. And obviously, when we're gonna eat and drink, just avoid using that method that we're seeing some people putting in the chin to try to eat. That's gonna start some of the deterioration of the feet. So you wanna remove it completely and place it maybe in a sealable bag or a paper bag while you eat and drink, and then just put it again if you're gonna reuse it. But do not try to kind of like put it in your shin or put it in your head, as I've seen some people do, because that's gonna start to deteriorate your feet, and you're gonna need then to replace it quickly. And after you're done, just remove it, wash your hand. In case you're using a reusable mask, you make sure that you clean, you put it away, or you dispose of it, depending on what you're using. Next slide. How long are we using a mask or a respirator? Depending of you're gonna use a disposable face bag, and again, that might be for your operation, might be something that you request people who enter to your site to use. Just make sure that you dispose of it after 1 day of use. Surgical masks also need to be discarded after 1 day of a use, and respirators are generally disposable again after 1 use if they're gonna be respirators that are disposable. Sometimes, and depending on the availability of the inventory and what we have in terms of economics of their sites, some people can make it last longer. But again, if you're doing a respiratory protection program, you should make sure that you're in compliance with the regulations. Again, these are different types of protection that offer different effectiveness in protecting. So some of them are going to be 99% effective, some of them are going to be less. Surgical masks or medical masks are going to be less effective than a respirator, but that doesn't mean that in conjunction with other strategies, we're able to get that risk reduction going on, depending on how the economic of your site and operation allows you to implement those programs. Next slide. In terms of rules for the use of respirators, and that's what I've been meaning to say in terms of regulations. If you as an employer or your employer is requiring you to use a respirator, we're talking about N95 and other respirators, you have a respiratory protection program. That means that there's some SOP or standard operational procedure right in that how you're gonna do it and implement it. You have to train workers, or you have to be receiving training on that program. There's gonna be a fit test to make sure that your respirator is the best fit and is actually protecting you. And you have to you have to be provided or provide the respirator. Also, there's a medical evaluation that comes out with using the respirators that every employee has to fill out as part of the respiratory protection program. If, as an employer, you provide or permit the voluntary use of respirators, there's an Appendix D from OSHA that will require you to fill out, just making sure that the person who's using voluntary the respirator in your workplace acknowledge how to use it, and that it's being used in a form that is adequate, but also that is used in a responsible way. So if you are letting people in your site, or if you are yourself being voluntary using that respirator, just make sure that you comply with the guides of how to use them well. People who use respirators in a way that is not adequate can present risks for other people or for themselves. So make sure that you are well trained in how to use them. Next slide. So one of the questions that we usually get is, wearing a mask or a respirator affect my health? Just be reassured that oxygen and carbon dioxide are very small compared to the droplets that you're getting protected by. So you're not gonna compile those between you and your mask, and you're not gonna get poisoned by your own breath. There's some effects of wearing masks for people. There's minimal effects for people, even with people with severe lung failure. So just make sure that you know that using respiratory protection is something that is safe for you. It might be not comfortable. It might be that you kind of like get, it's difficult to get used to, but it's not gonna affect your health using it. Against, like, the contrary, it's gonna protect yourself from other stuff. So no, you're not gonna get infected or poisoned by using a respirator. Next slide. So for the end of the presentations, we wanna go over how much does it cost in terms of infectious control. Sometimes we think, or we may have the impression that creating a ventilation system is going to be super costly. So we go over and talk about having N95 for every employee, but we want to go over some of the considerations. Again, this is not, doesn't mean that having a respiratory protection program is going to be the worst way. It's just to have in consideration other systems that we can implement in the place that can lessen the economic cost of having a respiratory protection program, but also knowing that we at least have to have one, and that not having one will cost us more in terms of the infection control programs that we have. Next slide. So when we don't have controls, just to take in consideration 2020 numbers for COVID-19, we had an average day away from work of 13 days, which could cost us per employee around more than $4,000 for each time that employee got infected by COVID for full-time workers, and around $2,000 for part-time workers, if we're talking about those 13 days in average. But also know that, like, the majority of the cases are actually between 11 and 20 days, so it can be more than actually the 13 days. So that's the cost of not having something to protect workers and having those spaces without any protection or adequate ventilation. Next slide. If we want to do a ventilation system or improve our ventilation system, just know the freestanding units or the HEPA purifiers that we see commercially can be around 200 and 900, depending on the size and depending on the type of filter that we're actually purchasing. And just consider that the replacement of the filter has to be done approximately every 6 months. So that's going to be added. But when you do that, you have to consider that one respirator, that one purifier that costs you around $300 for 1 day, it's going to be cheaper than actually losing an employee to being days away from work with COVID. Also, if you want to do systems that are basically general systems or HVAC systems, improving them or changing some of the structure to improve filtration and getting those pipes in shapes might cost you from $5,000 to $10,000 just one time in terms of improvement. So if you compare that to, again, losing the employee, just one employee for 13 days is going to be way lower than actually the loss of the employee, just giving that perspective. Next slide. Respirators, just taking consideration, N95, including fit testing, may cost you between $2,000 to $7,000 per employee per year, depending on the amount of respirators that you have to buy and the disposable piece of those N95 that we usually have. In the picture, you can see hood respirators. Those are less expensive because they don't need fit testing, so they're also used for some of the procedures. Obviously, we're not gonna use them for an outpatient areas, but if you have inpatient procedures or other areas like laboratories or areas that manage some of the lab testing or some of the infectious disease patients, you may be considering this as an option that's gonna cost you less than actually getting N95 for all the employees, the fit testing, and then the replacement of each of the N95 every time that they're actually gonna dispose of it. Next slide. And then some of the indirect benefits other than the economic piece, having a good ventilation in place also is associated with high comfort in the work, higher productive, increased service capacity, which is mean that if I have a good ventilation system implemented, I'm gonna be able to service or get more occupancy levels in my spaces. So I'm gonna be able to actually service more people. And then from a human resources perspective, not having employees not only getting sick, but also with the fear or concern of getting sick and being unable to perform adequately at the work. Next slide. So I think, Martha, this is our evaluation for the webinar. After that, there's a couple of resources that we have available for you to use. But I want to make sure that we have some time for questions if we have one.
Yeah, there was a question in the Q&A. I'll go ahead and read it. If we are working with nail salon technicians, would it be more appropriate to wear a respirator or have an air purifier, given the close and longer contact? Okay, so if we are, I'm guessing we're talking about the protection of the nail salon technicians rather than the person attending to the salon. So the nail technician is gonna be in a longer contact because they're gonna be there the whole day. If you are going there because you're gonna get an appointment, your time being exposed not as much. But for the nail technician, it's gonna be prepared to. You can have the air purifier. There are also some ventilation systems that create some extraction that are independent, and we didn't go over them here, but there are all other options to get the air out of the system. If you don't have an air purifier that is adequate for the space, you're gonna need to have that respirator on. Or you can do kind of like a mixture of both. If you're not sure that your air purifier is good, you can have some respirators or medical masks put in, and that could help compensate some of the loss. So I do have another question here regarding surgical masks are okay to use. I know most of the other, basically the industrial hygienists are saying that respirators are the thing to use. Respirators are the most effective
to get protected, but also when I do this from a social perspective, I acknowledge that not everybody's going to be able to buy one or get one. So we want to make sure that we know the efficiency level of surgical masks. They're not the best one to use, but they're also good, which means that they present some level of protection for us. They have efficiency. They are proven they have been proven over these years. They actually represent some protection to the person wearing it. So even though they're not the 99% that we want to have as a respirator, they're an option if we're not able to have that respirator. So that's why we're going over surgical masks and medical masks. So Dorothy, you're right. Respirators are the perfect to get protected if you don't have ventilation going on, if you have any other tools to aid you, but also be aware that people are not able to get those. And they also, it's going to be a challenging piece to get people to use them adequately if there are economic considerations to it. So regarding the use of funds, what is the reason for avoiding pointing them at someone? Is it to avoid to directly potentially polluted air towards a person? Correct. So you're not gonna want the polluted air going directly into one person. You want to get the air out of the room and get some circulation. So we're gonna create comfort, but we're not gonna get that air directly to you as we're usually used to. You're just gonna be able to get that circulation going on. Depending on how near you are to the ventilator fan or the ventilator, there's a risk in terms of the polluted air that you get into yourself. The near you are, it's gonna be more punctual. You're gonna get more direct, but even the ventilator has some kind of radius in terms of how it's pushing air. So you want to make sure that you're getting those in corners or areas that actually prevent them to getting to people directly and create that circulation on the air.
Thank you, Doctor. Any more questions? Please feel free to type them in the chat or the Q&A. And there's another one. Thank you.
Okay, I have another question regarding how we set up air purifiers. Can we put two to cover a larger space? And yes, you can add up the system performance and then use two to create like a cover of the larger space. They're actually able to add those systems. And there's a comment from Barbara saying, I don't know if I should read it on Spanish or English.
Yeah, go ahead and read it in Spanish. Yeah, for sure.
Okay. Creo que la mayoría de nosotros piensa en la comodidad en vez de seguridad. En el condado donde vivo, han dado N95 desde hace 2 años y hasta la fecha nunca he visto a alguien que la esté usando, incluyendo a los trabajadores del condado. And that's a good comment, Barbara. Yes, that's why we usually gonna be supporting or promoting to use other tools like the ventilation systems and like natural ventilation, because we know, especially after 2 years, we know that people are getting tired. There's gonna be some exhaustion going on, and again, the efficiency of a respirator depends on the person that has it put on. So if we're gonna depend on that to get our risk reduction, we're gonna have a few problems, especially with those cases where people are maybe not used to them or just not comfortable with them.
Thank you for your question, Barbara, and thank you, Doctor. And if someone is typing another question, or if there are no other questions coming in, I'm just going to quickly repeat this presentation is accredited for continuing medical and nursing education. So in order to receive your certificate, you are required to submit the evaluation. And just in general, we would love for you to submit the evaluation. We would love to hear your comments, any suggestions. Let me see, what else? What else do I need to add? Oh, everybody at the end, sometime today, after this presentation, we'll be getting a PDF copy of the slides, both in English and Spanish. And that also includes a recording in English and Spanish of this presentation. And I think another question just popped in the Q&A, Doctor.
So there's somebody asking for clarification on nail salons. I assume when the question was asked that we were talking about COVID-19 or infectious disease, there's a point to be made in terms of the vapors regarding nail salons and what we're doing with nail salons. So when we're trying to avoid exposure to vapors related to what we're using and products that we're using in nail salons or in hair salons as well, we need to make sure that we're using respirators that are adequate for the vapors that we're using. And that's another completely different webinar in terms of how to address or identify the respirators that actually can protect you from those vapors or chemicals that you're getting exposed as a nail salon technician. So if you're asking about exposure to chemicals, that's a whole nother piece. I assume that we were asking about nail salons because of the exposure to COVID-19, and that's gonna be purifiers and respirators like N95. We're gonna talk chemicals, and we wanna make sure that their other exposures are actually covered. We need to make sure that what we're using is actually adequate for that chemical that's being used. Thank you, Dorothy.
Thank you, everybody, for your great questions. Again, everyone will be receiving a copy of the PDF of the slides, English and Spanish, including the links to the recording English and Spanish. And if there are no other questions, I'd like to thank Dr. Maricel Pagan Santana for being with us and providing us this information, and also to our wonderful translators for providing this in Spanish as well. So thank you all. Thanks for being with us, and we hope you have a great day. Please keep an eye out on your emails, because I will be sending that email with all the resources later on today. Thank you, everybody.